Hello, this is my practice 80 here, and just wanted to show you all what I got in my small trauma kit. Now, before I start, I can't stress enough, always be trained in what you carry, no matter what it is. You want to make sure you have proper training. That way you know what you have and what you use without any delays in reaction. Okay. Now, first off, we have the body substance isolation equipment. Have a pair of goggles here. Keeps any blood spray out of my eyes. Got 2 pairs of non-latex gloves and a surgical mask. Always need those for any serious bleeding control. I have a Quick Clot Sport. It's hemostatic dressing. Put it in there, stops bleeding. We have an Israeli battle dressing. Helps that way, less than using a tourniquet, but more than just using standard gauze pads. Then I have assorted gauze pads for different uses. I got a 5x9 and some 4x4. Anything that's pretty serious but not too bad. And for covering it, I have a small roll of gauze and a ace bandage right here. Then I have my owie pouch. It's got some butterfly sutures, band-aids. It's got some antiseptic hand wipes and alcohol pads. Okay. For burns, I have 2 hydrogel burn dressings. Pretty useful, but not for anything serious. Any sucking chest wounds, I have Vaseline gauze. And this is a transparent dressing they use for securing IVs. Does a pretty good job of covering up sucking chest wounds because it's adhesive. Then I have a tourniquet. This is a ratchet style tourniquet. Pretty cut and dry. It's able to be used one-handed and able to be used on any entrapped limbs. Got some duct tape, which anytime I put a tourniquet on somebody, just pull a little duct tape off, put it on their forehead, and use a mini Sharpie here to write down the time. I have a chemical light for dark environments. Gives a better light dispersal than flashlights. Okay, then I got a triangular bandage. It's a pretty good strong type. Anytime anybody's got fractures or needs a sling, or even as an emergency tourniquet, a couple sticks or whatever. Okay. Then I have my instrument pack. I have a seatbelt cutter, which also doubles to cut off clothing, stuff like that. A pair of tweezers, just in case you get splinters or something, real aggravating things. A pair of small scissors. These things are good in case I have to cut off any dressings and put new one on there. Then I have my EMT shears. These things cut just about anything, even metal. I've tried it on coins before, it works. Have a CPR micro shield here. Space is at a minimum, so I want to keep everything as compact as I can. It's better than using just your mouth for CPR. And then I have my EMT pouch from Condor. I put a little use a red magic marker to put on the top strap. That way it can be identified as medical. And I also put my blood type on it, just in case something happens to me and the doctors need to know. And that's pretty much an overview of what I have in my kit. This isn't a instruction guide on how to build. This is just something I carry. And I want to remind you again, make sure you are trained in whatever you carry, because you don't want to be responsible for hurting somebody with something you don't know. Malpractice 80 is signing out.